fat shaming versus fitness shaming. So I'm going to talk about a few things in this video about both these issues of fat shaming and fitness shaming, and speak to perhaps some double standards. And I want to hit on fat shaming first. So I want to be clear that as far as differentiating between different issues that are not the same things. So on one hand, yes, I agree that it's not nice. It's not a good thing to relegate somebody to just one variable, right? Their physical appearance, their aesthetics, perhaps they're overweight, obese, they've struggled with weight throughout their life, and perhaps they've dealt with the issue of trying to manage their weight throughout their life. So it's not nice to shame people that they need to feel less than, meaning that their value is relegated to just that one thing. It's your weight, or whether you're if you want to use the word fat, obese, whichever one works for you. So people are much more than just one variable, right? People, your determination of your value as a human being, of course it's other things, in other words, right, in life. I could give a lot of examples of people's value and how we assign value to people. So yes, it's not a good thing to just shame somebody or to pick on them in that way, to exclusively focus in on that one issue that they're overweight. So that being said, there are different things where perhaps someone who's a family member, a friend, etc., a doctor, for example, who may feel concerned for a person's health. This would be health issues, right? So perhaps a doctor has a concern that a patient has developed diabetes type 2 or pre-diabetes. Let's say, and this is late adult onset, right? They've gained weight, they're sedentary. Let's say family members, for example, a parent, a sibling, you get the idea, might have a concern. So in a supportive way, they may try to encourage or point certain things out that are based on facts. That's more of an issue of your health, and because they do actually place value on you, the opposite, they're placing value on you in a much greater context. They want you to be well. They want you to be around for as long as possible. They would hope for you to have a better quality of life. So on this issue, this is being supportive or feeling concerned. This is not fat shaming, to be clear. So is the World Health Organization fat shaming people because they promote a hip-waist ratio, right? The hip-waist ratio is a determination of, actually a better determination of being at risk for certain potential health issues in the future, and your mortality and things like that. So essentially your stomach, your waist, measurement around circumference needs to be smaller than the hips, basically speaking. So if your stomach, your waist is bigger around, or the circumference is more around the measurement greater than the hips, this is not good. So is the World Health Organization fat shaming people for pointing that out? Of course they're not. So there are differences. You get the idea. So yes, it's not nice to single out one issue of a person and try to make them feel less than because perhaps they've struggled with managing their weight and have an excess fat that's unhealthy throughout their life. So this is not good. Most reasonable people would not agree to that. Okay. Being supportive, that's different. So we don't want to confuse these two issues as one and the same. They're not. Because sometimes it can be a distraction that people use the fat shaming way of speaking to be dismissive of things that are not about shaming. It's more about just trying to help people, right? So, okay, let's switch over to fitness shaming. Does that exist, right? I would say absolutely fitness shaming does exist. It sure does. And there's a bit of a double standard, in my opinion, that it's okay to point out the fat shaming issue, that this is not a nice thing to be doing to people. Perhaps we shouldn't do that, right? So yeah, maybe political correctness. You hear things like fat acceptance. Some of my contracts, they give you options of what you want to click on it in terms of how you promote yourself or how you identify. One of the options you can click on, fat acceptance, right? For example. So what about fitness acceptance, right? Or fitness shaming? In my past jobs, where I've worked in cultures where I was the minority, yes, a minority, someone who it was clear would eat healthy at work. Perhaps I might bring meals sometimes. And if I did go out to eat, I would always order the healthiest option possible. And then people would point out things, about my physical aesthetics. Oh, you're in shape, you work out. etc. So this would turn into people also taking jabs at me, right? What do you work out for all the time? You know, we're all going to die anyways. Here, eat a donut. Why? What do you do that for? So this is an interesting thing because I flip it around this way. When someone asks me, why do you do all that working out for? You know, you're going to die anyways. Trying to make me feel, basically, I feel bad about it or feel inadequate. Like, you know, maybe I need to question myself. So a lot of times I flip it around and I interpret their question as this, such as, I will say, so what I'm hearing you say is, why do I want to be stronger? Why do I want to have more energy? Why do I want to promote better sleep? Why do I want to freaking feel good? Why would I want to do that? Because that's essentially what people are asking me when they ask me why I do all that working out for, right? So this is it's nonsense, right? I remember a football coach in junior high school. He said one time, and he said, who here would not want to be stronger? In our off season, we had to do a strength training program and working out. Who would not want to be stronger? And that always resonated with me. It makes sense. It's a win-win. So yeah, why would I want to be stronger? Why do I want to feel good? Why do I want to have a better quality of life? That's what I hear when people ask me why I work out. It's ridiculous, right? So there is some fitness shaming. And to finish this off, there are different things here. It's one thing if someone exclusively, they have a very unhealthy balance with exercise. That can happen sometimes, maybe at the expense of other priorities. Maybe it is too excessive. And maybe the motivation is more about superficial stuff, right? That can happen sometimes with younger people. I want to get in shape for spring break, for example. So it's really not about the overall health. So a lot of assumptions can be made about someone who works out, such as, this person's full of themselves, it's their ego, or they're superficial, versus without even considering the bigger picture, that things you may not even consider or know about a person, such as their physical fitness and exercise that they incorporate in their life has to do with having a better mental health. It can be like a medicine for them. A lot of people exercise is like medicine, right? Self-care, the big picture of health, vitality. It's not as simple as aesthetics and what you look like. Sure, there can be a benefit. People can feel confident because you do look better in terms of your body composition, but that's a secondary extra benefit. As you get older, it's really about other things. Respect for self, responsibility to manage your health the best you can with what you have control over. So when you look at people from a much bigger picture context, you know, it's much more than that. So to make assumptions about people, why they work out their fitness, is really jumping to conclusions without really considering the larger picture of an individual. And technically it can be disrespectful, just like it's disrespectful to fat shame someone in a negative way. It's also disrespectful to assume things about people who work out and exercise, because that's more about yourself. If you're somebody who does that, you're doing it for yourself so you can feel more comfortable about your situation. And perhaps people might have other priorities. That's fine. It's a free country, right? But we don't need to be fitness shaming people if it's not your thing. It's all good, right? Just like I don't sedentary shame people. I have friends and know people that it's not their thing. They don't prioritize working out and exercise, and I do not hold that against them. It's what it is, right? People get the value they want from life. There's no judgment in that sense in terms of a moral judgment, good or bad, right? It's just more about people are what they are.